Uh, to bring this in perspective, HelpAge India has been working on the ground, and the closest I see is it's a disaster like the Rajasthan drought, where which begins in the month of March and then goes on till June, July till the rains fall. And this disaster of COVID is affecting the elderly just in the same way. What is happening is by the lockdown, we have entirely cut off the food supplies for elderly in the poorer segments. And it is now reached in the third week a proportion that we have to distribute family survival kits. I'll try to explain what this family survival kit is. If in India, many of our elderly poor we are working across the country with patients through our 160 medical units, which works in 125 rural districts, and we have 600 medical personnel treating on the ground. What we see there is, if I could have the next slide, and this is the distribution of survival kits across the country. And this is becoming quite a problem. I will explain to you why. Because these survival kits has 10 kg of atta, 2 kg of dal, some masalas, 1 liter of mustard oil or groundnut oil as the case may be, a packet of salt and some spices. And at the same time, in the same packet, there are 5 masks, there are 3 soaps and 1 washing bar, which is used for the people. In certain states like Bihar, we are giving sattu instead of atta. In Rajasthan, we are giving bajra instead of atta. So this is being distributed. Along with the distribution, there is a huge shortage of medicines. And as you all know that elderly suffer from NCDs, non-communicable diseases, which was explained quite well by Arokya Swami in the first presentation. So hypertension, diabetes, and lung problems are on the rise because they are not getting appropriate nutrition, and whatever we are giving in terms of atta, etc., is adding to the blood sugar level, and so people are eating mostly starch. So if you look at this has arrived at a season when the agricultural season is almost, the harvest is about to begin. So most agricultural labor are running with very, very little food in their houses. They have very little grain and the coping mechanisms are very, very poor. So if the lockdown extends, we will be entering a starvation phase. It will go from survival phase to a starvation phase, and then we may have facets of famine approaching, especially in the poorest districts. So this has been, I'm speaking as a practitioner because even in the city of Delhi, there is a place called Rangpur Pahadi, which is very close to Basant Kunj. And we had distributed ration there. And we found that many families, we are distributing ration only to the elderly, not to the other people. And we found that there is a fair amount of hunger in a colony which is very close to the posh colony of Vasant Vihar and colonies like that. So, and when we contacted the Delhi government, they said, no, everybody is getting home cooked food, and we are distributing in many places. But the reality is there are pockets of areas where it is not reaching. And next slide. Yeah. So what we are advocating is we have to look at the population of elderly in a segmented approach. There are about 23 million people who are destitute, who are the BPL card holders, and 90% of our country is in the unorganized sector. There is a typo there, and they need to be. They don't have no pension. They have no other provident fund or any care like that. Only the Indira Gandhi old age pension, which the government is announced that they released, is 200 rupees per month. And this money also reached in many parts of the country only on April 23rd. So this money is reaching almost at the fag end of the lockdown. Then we have another set of older people, which we call as above poverty line, socioeconomic category, uh, which is a D. And these are about 32 million elderly. And these 32 million elderly are the most affected. Neither do they get food ration for the white ration cards, and they do not get any food in other methods. And many of the children have migrated to the cities, and the migrants are stuck in various cities, are unable to come to their home villages. Now, this 32 million, in our opinion, we have been advocating that anybody with an Aadhaar card or a unique identity card should be given a set of ration. And this should be done away with this ration card business, at least for the COVID crisis, so that we have some level of nutrition. I'm not saying it's going to be appropriate nutrition. There'll be some level of nutrition so that they can survive through the COVID strategy. And of course, the middle class and the upper classes are about 40 million, and these have different needs. And we also have a helpline, which is 1-800-180-1253, working in 20 cities. And along with, we have a COVID SOS kind of app, which is providing volunteers at home level. You could actually log into COVID SOS and say that in your colony, there is an elderly who is not being assisted. And soon there will be a volunteer whom will approach them very quickly. There is also another issue which was in this urban population was caregivers were blocked. So many bedridden patients couldn't get their caregiver to come to their homes to look after them. Only 4-5 days before, we advocated to the Home Ministry, and they issued a new circular which allowed for caregivers to come into colonies. Many colonies were not permitting them, nor were the police allowing them to travel. So next is, so if, as it is a kind of a famine situation, we think that people have to rely on their coping mechanisms. And we have seen in Rajasthan, people during times of drought start eating foods which are locally available, which could be small tubers, could be small like bear, some fruits and certain items which they have been using. And there is a fair amount of knowledge amongst nutrition experts, what are the coping foods which are available locally. And the PDS, the public distribution system, is only reaching about 23 million elderly. And we also found that in our medical units, our doctors have said we are not able to give medicine for more than 15 days at a stretch, because we are also having a shortage of medicines, because procuring the medicines and getting it to different locations is getting to be a difficulty. Of course, we have been assisted by the Niti Aayog and the Civil Aviation Ministry to airlift medicine to some locations, which is a great help. Otherwise, they would not have the medicines, etc. Then, of course, Mathew Cherian had already raised about this whole question of social distancing. Because when you translate it into Hindi, it is Samajik Duri. And Samajik Duri completely talks about caste and class and the whole social distancing. So it should be physical distancing. And nowhere in the guidelines have they saying that people should sit in the homes and not even move out, because sunlight is a good source of for older people, and we need to see that they need to be coming out of their homes, because that social connect will not happen if you sit alone in the homes. So HelpAge has been advocating no social distancing but social connect. So people need to be social connected. Then, of course, most of the systems that have been designed have been for mobile phones, for smart applications, apps, etc. But we find that very few elderly use these kind of gadgets. At best, they have the smartphones, and those smartphones are the only ways that they can look at. So if we can look at socially connecting with them. And if you can also see that they can be provided with medicines. And I would also advise people to volunteer within their own colonies to see if isolated elderly are getting their own medicines or their groceries, and help them out. Only this will help them for health and well-being. And of course, the poorer elders in the village, we need to advocate to the government so that at least they get the survival nutrition, as I call it, in the future. So this is what I would like to bring out as a picture from the field. And as we are working on the ground, this is the feedback we are getting from the ground on the COVID response. Thank you.